Dr. Pai. I'm one of the residents here. It's nice to meet you. All right, give me a second here just to log in real quick. I think part of a millennial generation is maybe that we're a little bit more tech savvy, but I'd say I'm still about as average as it gets.
Let me get my computer up and running. I've been exposed to Epic for about 14 years now. I'm still learning on it. It's hard to break old habits.
When you first log into Epic, there's a lot of clicks and buttons and things you can do. And I knew I had a lot of tasks to do, and I didn't know how to achieve a lot of those tasks.
In Epic, I was always looking to improve. I feel like I got some good basics during residency, but knew there was always more.
There was things that I did well, but not as well as I should.
When I would click on something, I would talk to the patient, but then I couldn't figure out what to click on next. And so I was taking longer with my patient encounters, and that led to me falling behind in clinic.
I was spending a lot of time after hours. I think I was doing a lot of documenting outside of the room. I was trying to do some documenting of the history of present illness during the visit, which made me feel like I was sort of not connecting with my patient.
And so it became a little bit of a struggle, and I kept asking people in clinic for one-on-one teaching. I was like, hey, what do I do? How do I do this?
Before they came out, they sent out an email kind of seeing what our concerns, what our levels of strength were, and then they tried to tailor some of our learning to that.
I think they had maybe one lecture at the beginning that was just to kind of give people information about the pep talk.
They also had lunchtime meetings for just some of the general review of some of the basics.
But after that, it was a lot of one-on-one training.
And I'm just going to put down the instructions. They basically sit behind you going with the patient and then come out with some tips of maybe you could have tried this in this situation, or I don't see you utilizing this.
And then we practiced those things on another half day of clinic. And actually after just that half day, I started to switch completely everything that I was doing because they were pretty easy points. They had all kinds of stuff that I could improve on, but they also helped me identify the things that were probably the most useful.
So they helped me a lot with being more efficient in ordering and setting up preference lists.
One of the things I always use now is the widescreen view. I remember I tried it once and I was like, nope, I have no idea what all these views are. And then having someone sit down with me and actually show me how I can customize everything, it just basically provided a clean palette of all the tools that I could have in one drop window.
There's templates that I'm using that are much faster and more thorough.
Hi Cassandra, how are you today? So I would say it has definitely changed the amount of time that I spend face-to-face with my patient and not feeling like I need to be typing the entire time during the visit, which I think allows us to build a better relationship, allows them to feel like they're really being heard.
I want you to bend your knee. I want you to bring your knee up to your chest. I absolutely think I'm giving better patient care now.
I definitely think that there's improvement in quality of care across the clinic, not just with what I'm seeing in my panel, but also other providers who are doing the PEP training. Because we get better documentation earlier, and then we also are able to send results out to patients that they understand and actually can do something and act on. Cholesterol was 155. Yeah. That's good.
I'm spending less time on the computer at home and spending most of my computer time actually here at the office.
And that's really nice to just be able to sort of compartmentalize and really be done with work when I'm done with work.
It's helped me looking forward to coming to work every day.
We're hoping they come out again to get more, because that's the way education goes. It's learn and then relearn, and there's going to be upgrades and updates.
Oh, I would highly recommend training with the PEP squad. Everybody that I worked with was super nice. They were very, very helpful. Really went at the speed that I needed them to go at. Were more than willing to review basics if that needed to be done. We're willing to do more advanced things.
Thank you, and I would highly recommend the PEP squad to anyone that's trying to improve their EHR efficiency.